within 24 hours of improper brushing, the gum disease starts. But the gum disease is totally, the initial stages of gum disease is totally reversible. You can find out gum disease yourself in the mirror. Like there's a mild red in color, one area of the mouth, or a couple of areas in the mouth, or slight bleeding on provocation, and a bad smell, or colored coverings on the tooth surface, or bleeding without provocation also. These things, and immediately your gingivitis is reverted back to normal healthy gingiva. But if you neglect that, that is an acute phase. If you neglect that for years, then the chronic inflammation sets in, and the condition is early periodontitis, wherein you can find out the moment you open your mouth there is a lot of swellings, food getting stuck in, pain, continuous dull pain, itchy pain, you have a continuous headache, mild fever in the evenings, bad breath and all. But in advanced periodontitis, you can know that there is definitely the infection is set in. And believe me, these two are irreversible stages. You can stop the disease, but you cannot grow the gum back, or you cannot grow the bone back. Now coming to risk factors for oral cancer, definitely smoking, major cause. Smokeless or smoking, like cigarettes or any pan, zarda, all these things, or also cigars, everything, all are bad. Cheek biting, this is very common. People have their wisdom tooth not getting extracted if they still pierce on their gums, or if there is still an ulcer, or even a sharp tooth which is fractured due to some reason, they keep it in the mouth for many years, which will cause irritation continuously, and irritation continuously will cause major damage to your tissues. And spirits, alcohol and all, and even syphilis. In syphilis, nowadays it is not that common, but in syphilis also there is an ulcer in the mouth, and which causes cancer. Basically, you can see with a sharp tooth in the mouth set in. Okay, any unhealing ulcer for many years should be get noticed to a dentist or any surgeon or anybody. Other common dental problems are erosion. This erosion can be due to your dietary supplement, these things also. If a person is more exposed to citrus foods, then erosion will be more. Or it can be an occupational hazard also. The people who are working in battery factories, all those gets erosion. Here you can see the enamel is lost its hue, and the dentine, which is the inner layer, is seen. In aged look also, this is how the aged tooth looks. Some common aging things are attrition. This is physiological attrition. This is a wasting disease. Nobody can stop this. And abrasion, this is the second slide. What we call abrasion is, this is due to faulty brushing technique. This also will be depicted in 4th decade or 5th decade of life. And the root caries. Root caries is because of the faulty brushing technique or the recession of the gums, food get accumulated into the crevices of that tooth, and if you won't brush properly, the caries starts, and there is no, the root caries, nobody can stop. We have to extract the tooth. Decay, it can be prevented very initially. See, if you see a dark or black color line or food getting lodged in, you can go to a dentist and immediately he can seal that area, because if the crevices or deep, food gets in and bacterial colonization starts and decay starts. So if the pit and fissure is sealed properly, dentist will give you more cleanable area and you can get rid of caries. But if it get advanced and all, a grossly decayed tooth definitely should go in for a therapy called as root canal therapy. Basically, tooth has functional and cosmetic thing. The functional thing is for chewing or taking signals to the brain if the food is cold or hot. But after the root canal also, it can function. That's the reason why we ask you to go in for root canal therapy. The function of the treatment for gum diseases, we have initially, as I told you, oral prophylaxis is a out, and with this appointment, dentist will teach you how to brush in a different technique wherein you cannot reach earlier. You can get these oral hygiene instructions and get the different brushes wherein you reach a place where it is not easy for you to reach with a regular brush. And if this is missed and the patient is gone into gingival swellings and all, we can do a non-surgical therapy called as curettage and root planing, which is going deep into the gums and removing the infected tissue and maintaining the gum health, and after giving proper oral hygiene instructions. If these two phases are gone, patient is diagnosed with chronic periodontitis, then we do surgical procedures wherein we have to save the tooth, which is important for your dietary functions. Is proper. At least 2/3 of the bone should be there to do advanced procedures. We do advanced bone graftings where bone is lost. We do laser surgery where a patient is on high risk for bleeding, all those things. We do implant supported dentures if the patient lost all the teeth but demands for fixed teeth. We can put 4 or 6 implants, then give a fixed dentures. In adult age, what we give is, since the enamel is worn out and dentin is visible, we can give laminates which look like enamel and definitely add 10 years to your smile. And at any age, if the crowding is there and if you can't brush properly, at any age we can do orthodontic procedures. We have clear braces wherein nobody will know that some process is going on in your mouth. But prevention is key. Twice daily, floss regularly. Though in India we have lot of fibrous food, but still you floss daily, so that this is an interdental cleansing aid wherein interdental food which is lodged in, which causes root caries and all, will be removed. Eat a healthy diet with more fiber. Continue regular checkup at least once in a year. In US they go once in 6 months, but in Indian scenario, once in a year after 50 years of age, going to a dentist makes sense. And get screening before any major surgery is also important, because sometimes an undiagnosed chronic inflammation goes, though it is treated for cardiac surgery or anything, or for example in a diabetes state where periodontal infection is not controlled, after giving medication also, diabetes also won't, because it is a niche. You have to control the periodontal disease, then the diabetes also gets controlled.